Austin. I'm going to be your nurse today. Can you tell me your name?
Seth,
Seth. How old are you, Seth?
21.
Okay, that's good. Today you came in for a cardiovascular and peripheral vascular assessment. Okay, so there's going to be some touching, some listening. We're going to be doing some movements. I'll have you lay down, and a few other things that we're going to get into, and I'll let you know once we get in there. But like I said, it's going to be a lot of touching and a lot of listening with the stethoscope. If you feel comfortable at any time, just let me know. If you have any questions, I'll be giving you some general assessment, some general education along with the assessment, okay? So the first thing we're going to do, we're going to start off with your upper extremities, which are both of your arms. So if you don't mind, we go ahead and extend them for me just like this. Excellent. Okay, first thing I'm looking for symmetry. They are both symmetrical. And now I'm going to temperature is warm. Your hair distribution is nice and evenly distributed throughout your extremities. All right, next thing I'm going to assess, and that we got your temperature, I'm going to check for your turgor. Turgor has a lot to do with nutritional status, a few other things. Turgor. So next thing I'm going to do is I'm going to go ahead and grip my fingers. Squeeze, 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 squeeze. Good. So it's nice, strong, symmetrical grip strength. All right, you put your arm down. I'm going to go ahead and do your pulses. The first thing I'm going to do is on both sides. So can you go ahead and give me this right arm right here? All right, so flip your hand up for me. So this is your radial pulse. Nice, strong. And then right over here, you have your brachial. It's right above the end of your arm. It's a lot stronger than your radial in most cases. Good. Now I'm going to do the same thing on the other side. You have your radial. Excellent. Nice and strong. And brachial. Excellent. Both are strong. I'm going to go ahead. Next thing we're going to move on to is assessing, palpating and listening to your carotids. So when I did you sit up real straight and tall, kind of tilt your chin up to the sky. Okay. Look a little bit that way. This side looks good. Let's look at this side. All right. And I guess I'll go ahead and palpate since I'm already on this side. You have 3 different places I'm going to feel, okay? Excellent, strong. Perfect. Check this out. Palpate this other side. Excellent. Now I'm going to go ahead and listen. So while I'm listening, take a second to take a deep breath. But while I'm listening to it, I need you to hold your breath, okay? All right. Are you ready? Okay, go ahead and tilt your head up. Take a deep breath and hold it. All right, you can let that out. I'm going to do the same thing on the other side. So you ready? Again, take a deep breath. Excellent, you can let it out. Carotids sound very strong, nice and audible on both sides, all the way down. Next thing we're going to go ahead and do is we're going to move on, since we've already started listening, we're going to move on to your heart valves, okay? So I'm going to listen to several different spots here in your chest. It tells me different, when I'm doing it, I'm actually listening to different valves of your heart as blood goes through it. Your first one is going to be your aortic valve. It is at your second intercostal space here on the right side. So you see, you have clavicle, and your first intercostal, and then your second intercostal space right here. So I'm going to take a second intercostal space. So I have a listen. All right. Then I'm going to move on to your pulmonic. Your pulmonic is exactly opposite to your aortic, except it's on the left side in this second intercostal space. Again, 1, 2, see, put right across from each other. Your pulmonic. Next, I'll move down to your Erb's point. This one is at your third intercostal space, so one space below. Right here, and it's on your left sternal border. So you feel your sternum right here? It's right in this third intercostal space, right on the edge of that breastbone. Oh, excellent. Next we have your tricuspid. Your tricuspid is in the fourth intercostal space, also on the left sternal border. So here we're at your third. We're going to move down to your fourth. And it's right. Yeah, there it is. Excellent. Now this last one is called your mitral valve. It is in this. You said okay. So you have your clavicle. Sit up big and tall for me. You have, it is at your clavicular right here. It's a midclavicular line all the way down at your fifth intercostal space. It's going to be right here. And go ahead and take a listen. Excellent. Your mitral valve is also known as the point of maximal impulse. So whenever we have in just a minute, when I have you lie down, and we're going to test that apical pulse, that's where I'm going to be listening, that fifth intercostal space down here. That's where your heartbeat is going to be felt the strongest when it comes to your heart. So next thing, like I said, next thing I have you do is I'm going to have you go ahead and lay down for me. Alright, first thing I'm going to do is I'm going to assess you for jugular vein distension. A lot of times we refer to it as JVD. And that's when your jugular vein sticks out abnormally when you're not straining, and it can be signs of different types of diseases, okay? So the first one, you're going to look as far as you can all the way towards me. No signs. Perfect. Go ahead and look all the way. Excellent. Look all the way over there. No signs at all. So next I'm going to assess while you're still laying just like that. I'm going to assess your pericardium. Pericardium is just this area of your chest that has to do with your heart. Okay, just in like that, those central areas where your heart's located. Chest is symmetrical, looks pretty good. Excellent. Next thing I'm going to do, I'm going to have you slightly turn onto your left side. Just a little bit, just like that. I'm going to put this arm back here behind me. Just a little bit more. There you go. Perfect. I'm going to palpate your, just like where I listened when we were sitting up, all your heart valves again, okay? You have your aortic, your pulmonic, down one intercostal space, down to your Erb's point. And then now we're going to go down to your tricuspid, one over slightly here, just like when we were sitting up. Excellent. Now I'm going to go down again, that midclavicular line, over to your fifth intercostal space, which is right here, right in between those ribs. Now this is what I was saying about that, your apical pulse. This is where it can be felt and heard the longest. So a lot of times we have patients laying on their left side because it makes it even stronger. And it makes it a lot easier to hear types of murmurs and regurgitation of your valves, okay? Excellent. While you're still laying just like that, I'm gonna also listen to them with both sides of my diaphragm. I'm gonna have you sit back up in just a second, and I'm gonna listen again to your heart while sitting up with my bell side, because I only listened to one side when we started, okay? So, let's go. You have your second intercostal space, your aortic. Over to your pulmonic, down to your Erb's point. Tricuspid. And that mitral valve right here in that fifth intercostal space. Excellent. I'm going to switch it over here. Now listen to what my bell side. Your aortic. Again, over to your pulmonic. Down to your Erb's point. And to your tricuspid. And lastly, again, that fifth intercostal space back to that mitral valve. Excellent. Like I said before we move on down to your lower extremities, I'm going to have you sit back up for me and we'll listen one more time with the bell side of my stethoscope to your heart one more time. And swivel this way for me. Alright, just a little bit more that way. Right there. Okay. Now again with the bell side. Your aortic. And that second intercostal space. Over to your pulmonic again. Down to the third space, which is your pulmonic, Erb's point right here. It's on that left sternal border, remember? Cuspid. And over to that mitral valve last time. Nice and strong. Excellent. So, last thing we're gonna do, we're gonna move on to your lower extremities. So, lower extremities, and have you swivel back around, scooch back for me, have them legs up here on the table. Sit all the way up. Alright, just lay them legs flat. Again, just like with your arms, I'm assessing for both your legs being symmetrical. Your hair distribution is nice and even. Your temperature is very warm all the way throughout. I'm not seeing any signs of edema, which is excellent. Again, the temperature is nice and warm. Alright, any signs of varicose veins? And varicose veins are these little squiggly veins that you get, usually from prolonged standing, not good enough circulation, and they're like poke out. And you can just see them almost like spider webs all the way down the legs. Some just get them on one, others get them on both legs. But you have no signs of varicose veins, edema. Skin's very warm, hair distribution is very symmetrical. The very last thing we're going to do is I'm going to show you where your lower extremity pulses are located. First thing first, you have your femoral, which are on either side of your groin, right here and right here. Next, you have your popliteal, which it's located right here behind the knee. Sometimes it's a little hard to locate. Go ahead and just relax it. I'm just lifting up just right back here. It's a little fainter than your other pulses, but it's there, I promise. There it is. And I'm going to do the same thing on this other side. It's right here behind the bend of the knee. A little closer on the anterior side. now down this lower down here to your ankles, you have your posterior tibial pulses. So I'm gonna lift this leg up right here. It's located right here. Excellent. Now we're gonna do the same on the other side, but can you go ahead and swivel your body this way for me? Scoot back just a little bit, don't hang the legs off the table. Put them up just like. Feet up here for me. All right, we're gonna listen to that. Feel your posterior tibial on this side. Again, it's right here on the interior parts of your ankle, right behind that joint. It's nice and strong. Now, last ones you have your dorsal pedis pulses. Okay, you have them on both ankles. You have them on both sides. When it comes to your pulses and assessing them, you're going to be, most of the time they're symmetrical. You have them on both sides of the wrist, you need brachials along with your popliteals. And it's also included in your dorsal pedal pulses, so you feel it. This one can be sometimes very hard to locate. Sometimes they use Dopplers and ultrasounds where you have to listen to make sure there's arterial flow. But right here on this left one, yours is nice and it's easy to find. And then I'm going to do the same one on this side. It's right on the top of the foot, a little more on the exterior side. Excellent. And that concludes our assessment. Are you feeling okay? All right. Sorry about that. I didn't get a good view of your pedal pulses, so we're going to do it one more time. Your dorsal pedal is located right here at the top of each foot. Go ahead and put them back just a little bit for me. Scooch back. Make sure we're good there. Excellent. So they're right here on both feet, right here on the top. Sometimes they're a little hard to locate, but they're right. Excellent. And then you have your other one on this side, right around here. Excellent. Post-assessment follow-up on Seth, a 21-year-old male who came in for a cardio and peripheral vascular assessment. After introductions and explanations and information on what the assessment would entail, we started with the upper extremities. I had the patient extend both arms directly in front of him. We immediately assessed for symmetry. Both arms were symmetrical and of even length. Then assessed his hair distribution. Hair was distributed normally, bilaterally. His temperature was warm. Turgor was excellent. Patient was then educated on turgor and its role in assessment. Then we moved on. I had the patient grip or squeeze both of my hands to test for grip. His grip strength was strong bilaterally, and they were very equal in strength. Then moved on, we assessed patient's radial and brachial pulses. The patient was instructed on their location, then palpated them. We then moved on to the carotids. Upon inspection, both the left and right side had no obvious abnormalities, distension, or knots. Onto palpation. Pulses were strong in all three locations upon palpation on both the left and right side. Then I instructed the patient on how we listen to the carotids and their blood flow. I had the patient sit up, tilt his chin slightly up, hold his breath as I listened to one side, let the patient breathe, moved on to the other side. Again, tilt the chin up, deep breath, hold, listen. Blood flow was excellent and roots were very audible on bilateral sides of the carotid. We moved on to the heart assessment. We started off with general education of the locations of the auscultation areas, starting with the aortic, which is on the right side at the second intercostal space. Then we moved on to the pulmonic area, which is on the left side of the second intercostal space, directly across from the aortic. We moved down to Erb's point. The patient was instructed that this is at the third intercostal space on the left side at that left sternal border. Patient was instructed what the left sternal border meant. We moved on to the tricuspid area at the fourth intercostal space at the left sternal border, and then down to the mitral area at the mid-clavicular line. The patient was instructed on, or informed and educated at what the mid-clavicular line meant and where the fifth intercostal space was. The patient was then educated on the mitral area. Patient was informed of the point of maximal impulse, that being the apical pulse, and then auscultated all areas with the diaphragm of my stethoscope. We moved on. I had the patient lay down slightly to the left, and I had him extend his neck to the left and the right side, assessing for jugular vein distension. Patient was informed on common terminology, JVD, and with that it was just a simpler term of what we use. There was no signs of JVT, my bad. Next, we assessed the pericardium. No abnormalities were noticed in the chest. There were no bumps or any other abnormalities that I could see upon inspection or palpation of the pericardium. Next, we again educated the patient on the locations of the areas of the heart, and then auscultated all areas with both the diaphragm and bell of my stethoscope. No murmurs or regurgitation was heard in any valve. Patient was then instructed to continue just a little bit more to the left side, and patient was educated on the apical pulse again at that fifth intercostal space on that mid-clavicular line on the left side, also known as the mitral valve area. I then palpated the mitral area. After that, I doubled back and had the patient sit up to auscultate the the heart with the bell of my stethoscope, because I skipped that step in the beginning. Patient was educated, and then we moved on to the lower extremities. We started out with the inspection of the patient's lower extremities. There was no evidence of varicose veins or edema. The skin was warm. Patient had even hair distribution bilaterally on the lower extremities. Then moved on to educate the patient on the locations of the pulses on his lower extremities. We started with the femoral and its location on the left and right side of the groin, down to the popliteal, the posterior tibial, and then finally on to the dorsal pedis pulses. All were palpable pulses. Patient was educated on the trickiness of sometimes finding the popliteal and the pedal pulses, and